Good afternoon, everyone.
Good afternoon, ma'am.
Very good afternoon.
Good afternoon, ma'am.
Good afternoon. Last class, I already discussed about the nutritional, what is the ICU nutrition and what is the nutritional requirement for the HDU patient, that is the high dependency unit of the patient. And what is the calorie requirement of that those who are in the bedridden condition. I already discussed about the what is the elemental diet and the semi-elemental diet, since why it is required the elemental and the semi-elemental. And I already discussed about the total MNT therapy, that is the medical nutrition therapy, and what is the peg fed, jejunostomy feeding, and that rice tube feeding, and what food you have to include in that. Adults to feeding. What type of nutrition we have to include in there? The totally calorie requirement of the jejunostomy feeding, and the total protein requirement, carb requirement, and the total nutritional requirement of that patient. And specifically, I also suggest about the total the macro and micronutrient is highly required during the when the patient is in the high dependency unit. I already discussed about all these things. Today I will discuss about the nutritional requirement during the bonds. And you remember one thing, last class I already discussed about the dietary management during the surgery also. In the post-operative case, what is the nutritional management for the post-operative case? Mainly in the a complete assessment you have to do after the surgery, because that physical examination, in the physical examination you have to check the anthropometric measurement, such as the ideal usual body weight and the skin fold thickness of that particular patient. And you have to also check the clinical examination of the patient. In the post-operative case, each and every post-operative case, now you have to go through the what? The clinical examination of the patient. It's very vital. As for the after you have to go through the all the reports and the clinical examination, then only you have to able to write down the nutritional requirement of that particular patient. Mainly you have to, in the clinical examination, you have to check the presence and absence of the odema, and you have to check the abnormal changes in the skin, eyes, hair, and the cardiopulmonary function. That means specifically you have to check the what is the cardiac function after the post surgery, and what is the pulmonary function. Pulmonary function means lungs function after the surgery. And the functional status of the vital organs, like the functional status means you have to check the major organs body functions, like the you have to check the whether the pancreas is functioning properly. Otherwise, if the body is elevate the blood glucose level, or the blood glucose level will be decreases, that's why you have to check the first pancreas also is a very vital organ, and because it also regulate our blood glucose metabolism. And also you have to go through the check the cerebrum condition and the brain condition also, and kidney also, because it's totally depend upon the total your excretory system. And it also by evaluating the kidney also you can calculate the total amount of fluid losses throughout the day. It's also very vital. And also you have to biochemical examination. Biochemical examination means after the any kind of surgery you have to go through the blood, urine, fecal components reports, audiology, the enzyme, hormonal level that may be of the immediate metabolic consequence. And the medical and the diet history, it's also very important. Because medical history means first you have to go through the all the prescription what the doctor wrote, and you have to first go through the medication what the patient is dependent. And in some medication, if the patient is having the any kind of cardiac complication, in that case also you have to include some type of diet, and you have to exclude maximum diets. For that so only you have to totally go through the prescription of that patient. And also the main goal of this medical nutrition therapy is to maintain an optimum energy and the nitrogen ratio also, and also achieves a metabolism, and hence also after providing the medical nutrition therapy, it's also very helpful for the wound healing. Okay. And what is the post operative nutritional care? Mainly you have to recommend for the after the surgery, you have to recommend if the patient is underweight, if the patient body weight is underweight, in that case you have to recommend 35 kilocalorie per kg ideal body weight per day. That means the calorie requirement of that patient is 35 kilocalorie if the patient is underweight. If the patient is having the body weight condition is the normal condition, in that case you have to prescribe 30 kilocalorie per kg body weight. That means if the patient is having the 40 kg, means the per kg body weight you have to recommend 30 kilocalorie. That 30 kilocalorie is multiplied by the 40, and the total calorie requirement of that patient is that much only. Okay. And if the patient is the underweight, in that case for the underweight patient you have to recommend, if the patient is overweight, in that case you have to recommend 20 to 25 kilocalorie per kg body weight. If it will be increase the calorie requirement of that overweight patient, then gradually that body weight becomes increases, and it also causes so many complications. And the carbohydrate requirement for that post-operative case of the patient is mainly around 60% of the total energy should be provided from the carb only. Okay. About 60% of the diet should be get from energy from the carbohydrate only. And the protein is highly required after the post surgery, mainly because this protein it maintain the negative nitrogen balance in the most common nutritional deficiency related to surgery. Because after the surgery, in the post surgery case, the negative nitrogen balance is a very common symptoms. Due to the negative nitrogen balance, the nutritional deficiency is occur. To overcome that one, you have to provide the high biological value, good quality first class protein after the surgery. And unless until the patient is having no complication of the renal and the liver problem, you have to recommend 1.5 to 2 gram per kg body weight. Okay, the protein requirement after the post surgery is 1.5 to 2 gram per kg body weight. If the patient is having the any kind of kidney disorder or the liver problem, in that case you have to supply very less amount of protein. That means in that case you have to recommend zero point 0.8 to zero point 0.9 gram of protein per kg body weight. Otherwise, if the patient is not having any kind of renal means kidney problem or liver problem, in that post-operative case, you can recommend 1.5 to 2 gram per kg body weight per day. And you have to choose the first class protein, that high biological value protein. Which contains the high biological value protein? All the fresh foods, specifically curd, cheese, yogurt, milk, eggs, legumes, pulses, all these things are mainly contains the high biological value protein. And the next is your vitamins and minerals. Vitamins and minerals in the post-operative case, if there is the lack of iron, then it causes the anemia. Because after surgery, the hemoglobin level of the patient will be decreases. Due to that only, after the surgery, you have to recommend all the greeny leafy vegetables, legumes, pulses, and all the iron-rich diet. Also, in a post-operative case, before surgery, water and electrolyte balance should be maintained, and for the dehydration, acidosis or alkalosis, if the patient must be corrected. And immediate the post-operative period, you have to after 8 hours of the general surgery, the stomach has no leftover food at the time of surgery, and after that you can start the clear liquid diet or the normal liquid diet. And after the surgery, the calorie requirement, the energy requirement of that normal patient, the calorie requirement is 30 to 35 kilocalorie per kg body weight. And the protein requirement I already discussed about that. After the post surgery, you have to recommend 1.5 to 2 grams of protein per day per kg body weight. And also along with that, you have to include some macro and micronutrient and all the vitamins, minerals which is required for our normal body. This is all about your the diet requirement after the post surgery. बुझिए ना? All of you understood?
Yes, ma'am.
Ma'am.
Arpita,
Yes, ma'am.
after the post surgery, what we have to provide the patient? All of you clear about this? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Now I will discuss about the bones. In bones is a very critical condition. That bones are the injury to the tissue. Okay, it is called as the bones, and that result from the due to the any radiation or the chemicals or any electricity, otherwise any kind of from the heat also, and they are usually caused by the heat thermal burns such as the fire, steam, tar, hot liquid like this. Okay, and while burn caused by the chemicals are similar to thermal burns, those caused by the radiation or any kind of electricity disorder or any kind of sunlight also. And the thermal and the chemical burns usually occurs because heat or chemicals come in directly contact with the part of the body surface, and most often the skin. Okay, and mainly classification of the bones is very important. Classification of the bones means the bones is mainly classified into three types. One is the first degree of bones, and the second degree of bone, and the third degree of bone. What is first degree bone? You remember in the first degree bone, erythema is there. Means erythema means is nothing. Erythema is the redness of the skin produced by the coagulation of the capillaries with the cell destruction above the basal layer of the epidermis. That means above the epidermis, what will happen in the first degree of burns? In the first degree of burns, first the redness of the skin occur due to the coagulation of the capillaries with the cells destruction above the dermis. It is called as the first degree burn. And in the first degree burn na are not blistered. At that time, your अपन मानकर photo का किसी है ही नहीं हुआ. They are not form any kind of blister at the time of first degree of burn. In the second degree, when that burn will be proceed towards the second degree, na in the second degree of burns, na erythema is there and is characterized by the blistering with the necrosis within the dermis. That means blister must be there, and by blistering with the necrosis. Necrosis means the particular that area capillaries will be completely necrosis, means destroyed within the dermis. But in the first degree of burn, there is no question of any kind of blister formation. In the third degree of burns, what will happen? In the third degree of burns leads to mainly total losses of the skin, including the fat layer, hair follicle, and the sweat gland. In the third degree of burns, at that time, all the glands, specifically the fat layer, which is present above our skin, the skin, including the fat layer, will be completely burned. Hair follicles will be born, and the sweat glands, where the sweat is coming out, that gland is also affected. That is called as the third degree of burn. First and second degree burns heals in a day to week without any scarring. କିଛି scar formation କରିବନି, ସେ ଆପେ ଆପେ heal ହେଇଯିବ ଗୋଟେ ରୁ ଦୁଇ ସପ୍ତାହ ଭିତରେ. But in the deep second degree or small third degree burns, it takes weeks to heal and usually causes the scarring. Okay, and the third degree burns require skin grafting. In those who are having the problem of the third degree burning, they highly require the skin grafting. Specifically, first degree or the partial thickness burns regenerate new cells tissue from the the skin or the hair follicles, sweat glands and the sebaceous glands. That means if the patient is having the first degree burn, means in that case what will happen, the partial thickness burns regenerate new skin tissue from the epithelial cells of the skin or the hair follicle, otherwise in the sebaceous gland or the sweat gland. But in the second and third degree of burns, now what will happen? Now the full thickness burns do not have the sufficient skin because the skin will be totally destroyed for healing, and therefore extensive burns require skin grafting. That means in the first degree of burn, you need not require any kind of skin grafting. You skin neki gote jagar skin ko काटिके neki ଆଉ ଗୋଟେ ଜାଗାରେ ତାକୁ ପକେଇଥାନ୍ତି. The first degree it is not required, but in the some cases of the second degree and the third degree of burn, that patient may be need the what skin grafting. There are so many complications arises after the burns. Na? Most minor burns of the superficial do not causes any complication, but in the severe burn case, na, it causes the extensive fluid losses and the tissue damage is also there. Okay. After the burns, the tissue damage will be start and the extensive fluid losses will be occur after the severe deeply burn. Okay, and dehydration eventually develops in the people with the widespread burn. Dehydration is a very common symptoms after the burn, and destruction of the muscular tissue occurs in the deep third degree burns. Okay, in those who are having the third degree burns, means in that case, na, that the destruction of the muscle tissue will be occur, and the muscle tissue really realize the myoglobin, one of the muscles protein, into the blood. Okay, from the muscle tissue, in the muscular tissue, the myoglobin is the one type of protein, and after the burns of the third degree burns, in that case what will happen, that protein, means that myoglobin which is present in the muscles, that release the myoglobin and one of the muscles protein into the blood. In the blood, that myoglobin will be releases. If present in the high concentration, myoglobin harms the kidney because it will be pass out from the way, pass out from the muscles, and it will, that is the one type of protein. Myoglobin is nothing, myoglobin is the protein. The same protein that jitobole amaro myoglobin means is present in the muscles, that protein is present in the muscles. If it will be after the burns, what will happen, it will be released from the way, from the muscles. That myoglobin is not after the third degree of burns, it will release from the muscles and it will be circulate in the blood, and that will affect your kidney. That's why that is also that will definitely it causes the sometimes of kidney disorder. Okay, and and crusty surface means strictures are produced in the deep third degree burns, and that the dry scalp can become too tight and cutting of the blood supply to the healthy tissue and impairing breathing also is very common after the third degree of burn. Impairing of the breathing means say lokoro ଏତେ ପ୍ରୋବ୍ଲେମ ହବ ତ ତାଙ୍କର ବ୍ରିଦିଂ ପାଟର୍ନ ମଧ୍ୟ ବ୍ରିଦିଂ ରେଟ୍ ମଧ୍ୟ ଧୀରେ ଧୀରେ କମିଯିବ. Then what is the dietary management for burns? It's very vital. For the dietary management of the burns, it's very good to mainly in the nutritional care and the outcome in the dependent on the factor like the age. ଆମେ ବାସ୍ ଦେଖିବା କୋ ଏଜ୍ ଲୋକମାନେ burns ରେ ଆସିଛନ୍ତି. Specifically if the person is having the elderly people na, and very young children, pregnant women, lactating mother are highly vulnerable for the burns. Okay, And for health condition, you have to check whether the patient is having the diabetic or the cardiovascular complication or the any kind of renal complication. In the severity of the burns, mainly the location and the severity of the burns time lapse before the treatment, and that mainly after the burns, na, that period. One is your shock period, another one is your first one is your shock period, and uh, in the shock period, what will happen? Mainly, first one is your EBB phase, that is the initial phase. EBB phase is otherwise called as the shock period. During this phase, during the initial burns after injury, the focus is on the contract the stress and induce the neurohormonal and psychological response that accelerates the body metabolism by series of events. And mainly the children receive the maintenance fluid in the additionally, mainly in the first at hourly rate, 4 ml per kg for the first 10 kg of the body weight. Okay. If the patient is having the 10 kg body weight, means you have to provide 4 ml per kg for the first 10 kg of the body, and 2 ml per kg for the second 10 kg of the body with weight loss. First 48 hours is called as the EBB phase. After the any kind of burns, the first 48 hours it is called as the shock period, otherwise it is called as the EBB phase. Understood? ବୁଝି ବୁଝି ଯେତେବେଳେ
Yes, ma'am.
ଯେତେବେଳେ କିଛି ଗୋଟେ ବନ୍ଦ ହେଇଯାଉଛି ତ ପ୍ରଥମ 24 ଘଣ୍ଟାରୁ 48 ଘଣ୍ଟାକୁ ଆମେ କହିବା ଯେ କଣ EBB phase, but it is the shock phase. After the shock phase, the secondary phase is your flow phase or the recovery phase, and that phase will be starts from it will takes time 48 to 74 hours. In this case, what will happen? The fluid and electrolyte are reabsorbed into the general circulation, and excess fluid is excreted. Okay, whatever the extra fluid in the body, that will eliminate in this period, means during the flow phase or during the recovery phase. But initially, from after 40 to 74 hours, the fluid and the electrolyte are reabsorbed into the general circulation, and excess fluid is excreted also. This is your flow phase. In this case also, in the slow phase, you have to meet the increased metabolic needs for the energy. And during to the sepsis or the fever, increase the need of carbohydrate, vitamin B, minerals, and the vitamins are also needed for their regeneration. Because ଯେତେବେଳେ ଆମର थर्ड डिग्री कि सेकेंड डिग्री बर्न रे पूरा टिश्यू गुड़ाक पूरा जल की कैपिलरी ब्लड वेसल्स गुड़ाक पूरा नष्ट हो एट दैट टाइम आल्सो यू हैव टू include in your diet richer sources of carbohydrate, vitamin B complex, minerals, vitamins are highly required, and providing the healthy tissue for the subsequent successful skin grafting. In this period, in this recovery phase, you have to start the skin grafting. जहाँ भी skin लगे की treatment करे थे वो एक period रे अपन आराम से लगे पारिबे. What is anabolic phase? Anabolic phase means in this phase, mainly this period the patient is well hydrated and the reaction due to the metabolic stress are under control. Okay, the patient is fully hydrated and the reaction due to the metabolic stress are under control. What is the nutritional requirement during the flow phase or the anabolic phase? Flow phase and the anabolic phase means first 24 to 48 hours after the burns, it is called as the flow phase or the anabolic phase. In this period, you have to require the enough calorie to prevent the subsequent weight loss, and also you have to maintain the fluid and the electrolyte balance. It is also very important, and minimizing the stress response to pain and anxiety. Okay, minimize the stress response to the pain and the anxiety. It is totally depend upon the personal only, and maintaining a positive nitrogen balance. With the negative nitrogen balance, our body other complication arise. That's why you have to, after the any kind of burns, you have to maintain the positive nitrogen balance and replaces the depleted reserve of the minerals and the vitamins, and preventing curdling ulcer, ileus and other complication. Now I will discuss about the total calorie requirement per day. That means 25 kilocalorie into per kg usual body weight plus it is the total requirement of calorie per day. 24 kilocalorie multiplied by the kg usual body weight plus 40 kilocalorie. It is called as the total calorie needed per day after the what burns. In the bonds case, now you have to include about 60 to 65% of carb from the total calorie. Okay, and however, care must be taken regarding the maximum rates of administration feasible, keeping in mind the phase that the maximum tolerance level about 7 milligram per kg per minute. In the fat requirement, you have to, after the any kind of burns, now you have to include the very good sources of healthy fats, and that fat should be from the MCT form. And in that patient, the most of the patients are able to tolerate around 12 to 50% total calorie in the form of the lipids or in the form of the proteins. That means in the burns case, you have to provide 12 to 15 milligrams percentage of the what protein fat. And that fat should be in the form of the MCT form. Okay, MCT is your what? Middle chain triglycerides. In the protein requirement for the this after the burns, now you have to require the that the protein requirement is highly essential, because unless until the patient will be not get the proper protein, that in that case the burn will be not healed properly. Due to that only you have to recommend the good sources of protein, particularly for the after the burns, after any kind of burns you have to recommend 20 to 50% of total calorie, the total protein requirement of that patient is 4 to 6 gram of protein per 100 ml. It's required, and mainly the nitrogen losses at that time 25 to 50%, and the nitrogen losses by the phases have been estimated to be around 1 to 3 gram per day. And the requirement of the vitamins and minerals is highly required, because unless until the patient will be not get the properly vitamins and minerals, the wound will be not healing properly. When the patient is on the tube feeds, it's suggested to provide about 1500 ml twice daily, vitamin C 5000 international unit of vitamin A, and 1000 kilocalorie of energy being provided. Then hyponatremia. What do you mean by hyponatremia? What is hyponatremia? What do you mean by hyponatremia? Don't know.
Ma'am, low sodium level in body.
Low potassium level. Okay. Low potassium level in the body, it is called as the hyponatremia. Due to the hyponatremia, cardiac arrest may be also occur, and that the maintenance of the electrolyte balance is highly required. Okay, maintenance of sodium and potassium inside our body is highly required. If something will be increases, na, the other will be definitely, it will affect upon the other parameters. And after this burns, na, the mode of feeding, which type of mode we will be provided to the that burns patients. Specifically for the burns cases, now we are mainly advising that two types of feeding is available. One is your oral feeding and another one is your enteral feeding. Enteral feeding, enteral nutrition or the parenteral nutrition. In the oral feeding, now mainly tolerated by the patient. If the patient is having the if the scar, otherwise any type of burns will be occur in the mouth area, then at that time what we will do? How will we start the nutritional therapy? In that time, the patient will be depend upon for the enteral nutrition. Okay, enteral nutrition is highly required. In the oral feeding, now mainly concentrated oral liquid and the protein hydroxylates or the amino acid must be given to ensure the adequate intake. Okay, and solid food should be gradually introduced according to the food preference also. In the enteral nutrition, if the patient is not having any problem in the oral sector, then we will start the oral feeding. And if the patient is not able to take the food through the orally, then we will shift the patient for the enteral nutrition or the parenteral nutrition. In both the nutrition, in enteral nutrition and the parenteral nutrition, mainly means utilized judiciously alone or in combination with the other forms of the feeding during the various stages of the purpose. During the course of the treatment, that instance some patient may initially require the feeding, but bulk defined formula solution may be given. That is the enteral nutrition. In the parenteral nutrition, what will happen? In the parenteral nutrition mainly require for patient to provide the extra nutritional support. In the parental feeding, now you will got the one things from the parental feeding. It mainly the patient to provide the extra nutritional support of the if oral milk and the tube feeding are inadequate meet the high nutritional requirement. This form of feeding is most common used during the EPP and the flow phase. That is the parenteral nutrition. Now I will discuss about the trauma. What is trauma? Trauma is comes from the Greek word which means the wound. Okay, and the trauma is the form of shock to the human body which may occur in the form of the such injuries, otherwise some driving or compression of the specific wounds or body part organs such as the head or the spinal cord. That is called the trauma. ଯେତେବେଳେ ଆମେ ରାସ୍ତାରେ ଯାଉଛୁ ଧର ଆକ୍ସିଡେଣ୍ଟ ହେଇଗଲା ତ ଆମେ ସାଙ୍ଗେ ସାଙ୍ଗେ ଇମିଡିଏଟଲି ଆମେ କ'ଣ କରୁଛୁ ଗଭର୍ଣ୍ଣମେଣ୍ଟ ହସ୍ପିଟାଲ କୋଉଠି ଟ୍ରାମା ସେଣ୍ଟର ଅଛି ତ we will immediately shift the patient from the hospital to the other hospital for the proper management or for the proper treatment. ରାକେଶ ବୁଝି ହଉଛି?
Yes, ma'am.
ନା କଷ୍ଟ ହଉଛି?
ନାଇଁ ମ୍ୟାମ୍ ବୁଝି ହେଉଛି।
କୁସୁମ ମ୍ୟାଡାମ ବୁଝିପାରୁଛନ୍ତି? କୁସୁମ
Yes, ma'am.
ବୁଝିପାରୁଛନ୍ତି? Are you understood what I am saying? What is the physiological response to the injury? In physiological response to the injury, mainly physiologically, it depends upon the LD or the EBB or the shock phase, and the second one is your flow phase. And the second one is mainly characterized by the hypermetabolism and increase the cardiac output, increase the urinary nitrogen losses also, and alter the glucose metabolism at the accelerator with the what tissue catabolism also. Then metabolic response to the injury. How our body metabolic response towards the injury mainly alter the glucose metabolism. In this case, now first it alter the glucose metabolism and alter the protein metabolism also and alter the fat metabolism. What is altered fat metabolism? In the altered fat metabolism, the stored fat mainly deposit are mobilized and oxidized at the high rate in order to support hypermetabolism and increased gluconeogenesis. Okay, and severely injured patient if unfit or deplete their fat and protein stores rapidly. What is the nutritional requirement after the trauma? Okay, that nutritional assessment of the trauma patient is done to determine the energy and the protein requirement. Mainly, that dietary protein is required is a greater amount to achieve the nitrogen balance. Okay, mainly 15 to 20% of calorie intake should be from the protein only, and the carbohydrate requirement should be from the 60% of the calorie needs to be needs, and the rest of energy needs should be met by the fat. And vitamin C is also very much essential after the trauma condition, and the macronutrient like the potassium, magnesium, zinc, all these vital things is highly required after that trauma. In the oral nutrition, the patient mainly depends upon the what the route of nutritional support, or the oral, or the enteral, or the parenteral. By these three methods, we are doing the what mainly by these three routes, the patient will be got the nourished, and oral and the enteral route are generally preferred over the parenteral administration. Now I will discuss about the nutritional requirement for the sepsis. Sepsis, what do we mean by sepsis? Sepsis is a very serious condition. In that case, the mainly it is defined as the presence of an infection due to the identifiable organism, a bacteria, and the toxin leads to the strong inflammatory response. The infection may be through the viruses, through the fungi, or the parasite also cause the infection and the inflammation also. It is called as the sepsis. सेप्सिस होची जेतबेले बॉडी रो बहुत सारा कंडीशन अति सीरियस को जाइतिबो से समय हमरा आपनकर सेप्सिस कंडीशन डेवलप करिवो दैट मे बी ड्यू टू द viral infection or the fungus infection or any kind of bacteria or infection. And in that sepsis na mainly the systematic inflammatory response syndrome, that is the SIRS, systematic inflammatory response syndrome, and it is the term used to describe the inflammation occurs due to infection heitibo at that side inflammation must be there in bones of the multiple trauma, shock, and the organ injury also. Okay, and in sepsis na the inflammation is usually present in the area much away from the primary site of injury and affect healthy tissue also. ओके जोटी आपनकर प्राइमरी इन्फेक्शन थिबो सेही जगह रे आपनकर सेप्सिस डेवलप न करी ताट टिके दूरे जाय मते साइट ऑफ इंजुरी साइट रे मते हबार चांस अच्छी एंड association between the term sepsis and SIRS. SIRS is nothing. SIRS is the systematic inflammatory response syndrome. That is the SIRS. Okay, and that can be better understood by the diagnostic criteria. Leave it. And yesterday also in the class I already discussed about the MODS. What is MODS? MODS means multi organ dysfunctional syndrome. राकेश खाली कही ना मो क्लास रे MODS विषय रे
Yes, ma'am.
कौन कही मल्टी ऑर्गन डिस्फंक्शनल
Dysfunctional.
syndrome. Okay, MODS होची multi organal sepsis through it may be leads to the MODS. जेतल sepsis हे जिवो any kind of infection होबो that may be bacteria हे पारे virus हे पारे fungus हे पारे that infection may leads to the inflammation. Infection to inflammation to that may be shift towards the what? MODS. MODS is nothing. MODS is the multi organal dysfunctional syndrome. मल्टी माने बहुत सारा ऑर्गन गोटे थरक रे खराब होबा आरंभ करिवो दैट इज ए मल्टी ऑर्गेनल डिस्फंक्शनल syndrome. In that case mainly the lungs failure may be occur. That lungs failure may be followed by the failure of the liver, intestine, kidney. In that case it is called as the बॉडी रो जितकी जे को मेजर ऑर्गन गुडा को धीरे धीरे जेते लिवर हो कि इंटेस्टाइन हो कि प्लाज्मा दैट लिम्फ नोड्स हो ए सब जिंस गुडा को नष्ट हो जिवो इंटेस्टाइन लिवर एंड द किडनी फेलियर हो जिवो दैट इज कॉल्ड एज द MODS. MODS जो जगह रे हेतिबो that mainly एटा होची कोन पे ना MODS appears to be immediately mediated by the चोटी जो मल्टी ऑर्गन डिस्फंक्शनल सिंड्रोम जो डेवलप होची मेनली सिटी एक्सेसिव प्रोडक्शन ऑफ द प्रो इंफ्लेमेटरी साइटोकाइनेज कहै छी आपन को इन्फ्लेमेशन भी होची तो प्रो इंफ्लेमेटरी साइटोकाइनेज एंड अदर मेडिकेटर्स ऑफ इन्फ्लेमेशन एई दीटा जिंस रिलीज होबा लागि से जगह गुडा को आपन को कोन स्वेलिंग लागुची अकॉर्डिंग टू द गट हाइपोथेसिस disruption of the gut barrier functions results in the translocation of the enteric bacteria into the mesenteric lymph node. In sepsis or the MODS case ना जदि हमर sepsis कि MODS आडको गोटे पेशेंट कंडीशन गति करछि देन सेमानकर कोन थाए ना blood temperature will be reduces, okay, and heart rate will be increases and the heart rate will be 90 beats per minute and hyperventilation, that means the respiratory rate is also decreases, that means it more than 20 beats per minute, and the partial pressure of the carbon dioxide less than the 32 mmHg. Okay, the partial pressure of the carbon dioxide is less than 32 mmHg, and in that case none the WBC count is less than 4000 cell mm³ due to the infection. And mainly this infection is in this case na the metabolic and the physiological response is relied partly to the patient age, previous health status and the pre-existing disease also. Okay, and the organ system failure may mask the manifestation of the system infection also. In the systemic metabolic response, what will happen in the systemic metabolic response? Mainly hypermetabolism. Hypermetabolism means oxygen consumption is elevated in the infected patient. Okay, the consumption of the oxygen is rises in the infected patient. It may be 50 to 60% higher than the normal and related to the severity of the infection. Okay, normally जितनी की दरकार तो ताकि 40 to 60% excess दरकार पड़ता है due to the severity. It mainly depends upon the severity of the infection, and the partial pressure of the carbon dioxide is also less than 32 mm/Hg. specifically in the either that may be in the pre-operative case or in the post-surgery. In that case, what will happen? Na post-operative, post-surgery injury periods, na such a response of an upper secondary to the severe pneumonia. Pneumonia भी type of abdominal infection भी type of other wound infection must be there, and increased metabolism is related to the fever. Because of the high metabolism rate, it also increase the fever rate also. Alter the glucose metabolism. What is alter the glucose metabolism? The alter mainly in the systemic metabolic response. Na mainly it alter the glucose metabolism. It alter the protein metabolism. It alter the glucose metabolism means the blood glucose levels are generally increased in the infected patient, but plasma insulin levels are normal or even high in the previous health history who developed the infection. And the altered protein metabolism, that means in this case, in the systemic metabolic response, what will happen? The alter the protein metabolism, that means there is the increased proteolysis and the negative and the nitrogen excretion, resulting in the negative nitrogen balance following an infection. That means increase the proteolysis, increase the proteolysis and the nitrogen excretion, resulting in the negative nitrogen balance mainly occurs, and the amino acids flow from the skeletal muscles is also increased. Okay, the amino acids flow from the what? From the skeletal muscles is also increases in the patient with the sepsis case, and alter the fat metabolism and change in the trace minerals also. Alter the fat metabolism means what? Fat is, all of you know that fat is the major fuel and oxidizing the infected patient. If the nutritional support is inadequate, the peripheral fat stores are mobilized. When the outer input will be very less, at that time the peripheral fat stores are mobilized and increase in the sympathetic nervous system activity variable and the increase in the lipolysis process. What about the trace element? Mainly the iron and zinc level in the blood are decreased. Okay. देखो जेकोसी इन्फेक्शन केस रे हमर जदि माइक्रो न्यूट्रिएंट कथा हम चिंता करबा तो स्पेसिफिकली आपण मानकर जिंक हो किबा आपणकर एनी सीड्स हो ए सब इन्फेक्शन रे जिंक रो एंड आयरन रो लेवल ता तुरंत कमी जाए सेट में आपण देखि दिबे एनी पोस्ट ऑपरेटिव केस रे जो जिंक सप्लीमेंटेशन अधिक थिबा से वाला टैबलेट डॉक्टर मन लिखंती because it will increase the blood circulation and also very good after the post surgery case. In the mainly, I already discussed about the multi-organ dysfunctional syndrome. In this case, the failure of the essential organ is the most severe complication of the sepsis and may result in the death also. Okay. If the patient is having the sepsis condition, in that case, if that multiple organ dysfunctional syndrome will be developed, in that case, what will happen? The skin will be very prone towards the infection, and the treatment of systemic infection therefore constitute often the use of the antibiotics and support of the cardiovascular and the respiratory function also. In the MODS case, the septic shock may lead to decrease in the peripheral resistance and cause pulmonary insufficiency. That means mainly in this the MODS case, what will happen? The septic shock may lead to the decrease in the peripheral resistance. The resistance of the peripheral region will be decreases, and it also the cause of the pulmonary insufficiency. And mainly in the MODS case, the treatment of the systemic infection therefore consists of use of the antibiotics and mainly supports of the cardiovascular system and the respiratory functions also. Now I will discuss about the dietary management. What you have to provide during the sepsis with or without the MODS. Patient sepsis type, but with or without the condition of the MODS. All of you know about the MODS is nothing. MODS is the multi-organ dysfunctional syndrome. And what is the dietary management during the sepsis and during the MODS? Patients suffering from the MODS or sepsis result in multiple system organ dysfunctional and critical ill and admitted in the intensive care unit of hospital. And they usually with the impaired immune function. Those who are having the sepsis condition or the MODS, in that cases, na the what? The immune system will be function will be decreases and compromised cardiopulmonary functional capacity, and such patient may also have the reduce the functional and the regulatory capacity of the renal and the gastrointestinal and they impair the immune function. Okay, it will decrease the reduce the functional and the regulatory capacity. Also, it mainly impact upon the gastrointestinal tract and the impaired immune function also. Why this nutrition play a major role for the management of your MODs? Because through the proper nutritional care only to minimize the development of the nutrient imbalance. Okay, in that case, the nutrient imbalance must be there. To overcome that one, you have to recommend some nutritional care. It's very vital and maintain the fluid and electrohomeostasis. It is also the very good point for the maintaining of the fluid and electrolyte homeostasis, and also promote the energy equilibrium and to help in achieving and maintaining the normal safe level of the macro and the micronutrient. The total energy requirement during the MODS. The energy requirement during the MODS generally in the MODS means what? Multi-organ dysfunctional syndrome. In that case, the patient is having the hypermetabolic state. Okay, the metabolism of the patient will be increases, which results in the weight loss. Hypermetabolic state. In that case, the weight loss is very common. In those who are having the sepsis or MODS, na, they are having the problem of the what? Hypermetabolic state, and it will reduces your weight. And critical ill patients are generally able to tolerate it about the if we will plan the diet for the very old person. So in that case, they will not take whatever we are suggesting. Na, they will not listen at all because the critical ill patients are generally to tolerate around 20 to 30 kilocalorie per kg usually body weight. And adequate that energy is essential for the metabolically stressed patient, and excess calorie intake and the client complications to the hyperglycemia. And in the MODS case, what will happen? The blood glucose level will be increases, and also the excess CO2 production, the carbon dioxide release is also it increases, which can excrete bad respiratory insufficiency or the prolonged warning from the mechanical ventilator. Okay. Protein. What about the protein? The protein requirement for the sepsis and for the MODS patient is 1.2 gram raw, 2.0 gram per kg body weight is required. And mainly the protein should be in the very good sources of protein, and adequate amount of protein is required by the patient to improve the immunity against the infection. And it also promotes the recovery spare in body mass and reduces the amount of endogenous proteins. And what about the carbs? And what about the fats? Carbohydrate and that should constitute nearly 60 to 70% of the total energy, and glucose is the primary calorie substract in a parenteral nutrition pharmacist. The carbohydrate requirement of that MODS patient or the sepsis case, now you have to provide 60 to 70% of carbohydrate is highly required, because from the the glucose is the primary calorie substrate in the parenteral nutrition formulation. In the micronutrient, if you are providing the diet for the MODS patient, you have to give more emphasis to the micronutrient, because the nutrient of the almost all vitamins and certain essential amino acids due to the infection and the inflammation. In the presence of underlying complication, adequate intake of the minerals and the trace elements like the calcium, zinc, sodium, potassium and magnesium is suggested. तो ये सब जिनस कार्ब केते देबा, प्रोटीन के complication of the liver kimba odema kimba any kind of kidney disorder, and sodium and the potassium intake should be regulated. Okay. Specifically for the MODS patient, liberal amount of food rich in vitamin B complex, vitamin C and vitamin A is highly required. What is sepsis? What do you mean by sepsis? Sepsis को लेने कौन बुझी मैम?
Ma'am, any infection by fungal or bacterial or viral?
Very good. That is the sepsis. What is MODS?
Multifunctioning multi-organ dysfunction.
Dysfunctional syndrome. What is adrenocorticoids? Adrenocorticoids means is the hormonal secreted by the adrenal cortex. Okay. And what is cortisol? Cortisol is nothing. Cortisol is the glucocorticoids produced by the adrenal cortex. Okay. What is homeostasis? Homeostasis means a balanced normal state of the body metabolic and the physiological function. A balanced normal state of the body metabolic and the physiological function. What is SIRS?
Systematic inflammatory response syndrome.
Severe systematic inflammatory what?
Response syndrome.
Response syndrome.
Syndrome. That is your SIRS. Okay, it is hypoxia. Hypoxia.
Of oxygen. Lack of
What?
oxygen.
That is the hypoxia. Very good. Very good. What is the major difference between the flow phase and the EBV phase? Ebi कहतली bonds रे पढ़ेली what is EBV phase and what is flow phase? EBV phase what is
48 hours of accident is.
In the flow phase mainly it starts from the 24 to 48 hours of injury and may last for several days or the weeks. That is your flow phase. But what is EBV phase? In the EBV phase it mainly develops the immediately after injury and last for about the 24 hours. That is your EBV phase. Okay, in the EBV phase it will up to the 24 hours only, and that EBV phase will be developed after the injury only. And the EBV phase it will occurs with 24 to 48 hours of the injury and may also last for the weeks also. Okay, and in the EBV phase your glucose production will be normal, but in the flow phase now the increased glucose production. In the EB phase low insulin concentration, but in the flow phase the insulin elevated its concentration. Okay, and elevated the blood lactate level in the EBV phase, normal blood level in the what lactate level. In the flow phase, that means up to 24 to 48 hours of injury, the cardiac output will be increases and the cardiac output is below than the normal in the EBV phase. What is the major difference between the EBV phase and the flow phase? In the EBV phase, mainly the blood volume will be decreases, but in the flow phase, your cardiac output will be increases. In EBV phase, the cardiogenic shock is there, but in the flow phase, increased urinary nitrogen losses. And EBV phase, hypotension is there. And the flow phase, the alteration in the metabolism of the carb, proteins, and the fats. Okay. In the EB phase, the hyperventilation. And generally, sepsis means what? Sepsis means it is the bloodstream infection, and it is very severe infection in any organs. Mainly, it's caused by the known or the unknown reason. Also, in the septic shock or the septicemia. Septicemia means infection in the blood. That is the septicemia. And what is MODS? MODS is a multi-organ dysfunctional syndrome. It may be progress to dysfunction of the circulatory system, and even under the optimal treatment, it result in the development of the multi-organ dysfunctional syndrome. And the calorie requirement during the MODS, the total calorie requirement during the multi-organal dysfunctional syndrome is means 25 to 35 kilocalorie per kg used body weight per day. 25 to 30 kilocalorie. And the protein requirement of that MODS patient is 0.8 to 2.0 grams. If the patient is having the MODS, along with that the patient is having the complication of the CKD or the liver problem, in that case you have to give the give the protein 0.8 to 2 gram of protein is required at that time. And the fat should be in the 20 to 30% of total calorie from the fat only. And the micronutrient like the biochemical test and the mode of feeding, oral, enteral, and the parenteral. Micronutrient intake should be governed by the medical reports only. যদি রিপোর্টস রে কো এলিমেন্টস কম দরকার থিব তা কম দেব, যেটা অধিক দরকার থিব তাকে আমি অধিক মধ্যে দেই পারিবা। Nutritional management of food in allergic and the food intolerance. कुलसुम मैडम बुझी उची?
Yes, ma'am.
Hello.
Yes,
May I
ma'am.
audible? May I audible? Am I audible too?
Yes, ma'am. You are audible to me.
तो बुझी उची?
Yes, ma'am. I'm able to understand.
Okay. What is sepsis? What is sepsis? What is MFN-5?
Bloodstream infection.
Now I will discuss it. Nutritional management of food allergic and the food intolerance. Okay. What is the nutritional management for the food allergic and the food intolerance? What is the adverse reaction occur after taking of any kind of allergic food? What is the adverse reaction occurs inside our body? ଯେତେବେଳେ ଯେକୌଣସି ପ୍ରକାର ଯଦି ଆମେ କିଛି ଏପଟ ସେପଟ ଖାଦ୍ୟ ଖାଉଛେ ତାହେଲେ ଇମିଡିଏଟଲି ଇଟ୍ ୱିଲ୍ ଇମ୍ପାକ୍ଟ ଦ ଆଡଭର୍ସ ରିଆକ୍ସନ ଇନସାଇଡ୍ आवर बॉडी। तो से जो कॉम्प्लिकेशन हुए, व्हिच टाइप कॉम्प्लिकेशन इज राइजेस आफ्टर द एडवर्स रिएक्शन, कौन हुए?
मैम वोमिटिंग हुई।
दस से तो
Skin rashes.
वेरी गुड. देन अदर कौन? यस
Ma'am, diarrhea.
अर्पिता.
Yes, ma'am. Itching way.
अदर कॉम्प्लिकेशन.
Ma'am, diarrhea.
वेरी गुड.
मैम आपनका म्यूट अछि।
After the consumption of the special food, allergic food, and have reported immediate and often dramatic physical reaction occur, like the diarrhea, vomiting, muscular cramps, wheezing, swelling of the airways, and the severe drop in the blood pressure. This is the common complication after ingestion of the any kind of allergic food. And those who are having the lactose intolerance, they cannot digest the sugar or the any kind of lactose in the milk. And after ingestion of the any kind of dairy product, they are having the complaint of that bloating or the abdominal pain, and also other complication. These are in fact were different conditions which link food to adverse reaction. And food allergic and the food intolerance can cause much more than annoying the gastrointestinal many type of complication. And in some cases, now they cause no obvious symptoms until a chronic disease shows up. Okay, and mainly the adverse food reaction. Adverse food reaction means what? After intake of any kind of allergic food, it causes so many complications. And in some cases now that adverse reaction is a very general term and indicating a clinically abnormal response or the reaction to expose to the food regardless of mechanism. Adverse food reaction that may be toxic ହେଇପାରେ କିମ୍ବା intoxic ହେଇପାରେ. In the intoxic, otherwise it is called as the non-toxic. In the non-toxic of food reaction, hypersensitivity is there. It's the hypersensitivity is there in the non-toxic adverse food reaction. But in the toxic case, the bacterial toxins, the fungal toxin, and the chemical and other toxins. Due to that, also adverse food reaction occur. In the hypersensitivity means hypersensitivity is allergic hypersensitivity that may be non-allergic hypersensitivity. In the allergic hypersensitivity, what will happen? The immunological mechanism involved or the suspected. In the allergic hypersensitivity, mainly immunological mechanism involved or suspected, but in the non-allergic hypersensitivity or no immunological mechanism can be provided. Food intolerance, enzyme deficiency, psychological, food additive, or the food irritant, or the food indigestibility. These all are the non-immunological mechanism can be proved also. But in there are different types of mediated reaction like the IgA. IgA is the one type of the allergic sensitivity reaction. In the IgE, mainly immunoglobulin E, that IgE modified that food allergic or the helminthus intestinal parasite. And the non-IgE mediated means in this case the antigen or antibody complex high sensitivity, hypersensitivity. What is food allergic? Food allergic is the hypersensitivity. At the typical example of the food allergy, it is called as the hypersensitivity. And food allergy or the hypersensitivity is a very abnormal response to a body by our immune system. It's not the normal. And in this case, then hypersensitivity, a non-toxic allergical hypersensitivity is mediated or immunological mechanism is involved or the suspected. The in our body now that immunoglobulin, 5 classes of antibodies have been identified. Mainly in our body that immunoglobulin A, immunoglobulin D. Immunoglobulin D is otherwise called as the IgD. Immunoglobulin A is otherwise called as the IgA. And immunoglobulin E is denoted as the IgE, and immunoglobulin G is the IgG. And immunoglobulin M is IgM. What is immunoglobulin E? Immunoglobulin E is otherwise called as the IgE. It mainly helps to eliminate parasites. Okay, immunoglobulin E is mainly helps to eliminate the parasites, helminths, and is responsible for the classic allergic reaction. Okay, IgE is the mainly responsible for the classic allergic reaction, commonly referred to as the food hypersensitivity. And there are types of allergic reaction. There are mainly 3 types of allergic reaction. One is the type of allergic reaction, type 2 food allergic reaction, and the type 3 food allergic reaction. In the type of food allergic reaction, mainly it is the IgE mediated reaction. Otherwise, is the immediate hypersensitivity alpha lytic IgE mediated reaction. And type 2 is otherwise called as the cytotoxic hypersensitivity. And the type 3 is otherwise called as the Arthos reaction, antigen antibody, or the complex hypersensitivity. But in the cell mediated immunity or the delayed hypersensitivity is your type 4 reaction. There are different types of symptoms of food allergic, like some of the gastrointestinal reaction may be occur. Skin cutaneous manifestation is also there. Respiratory symptoms may be developed after the food allergic, and systemic manifestation is also there, and neurological behavior. In the GI system, we are having the in GI. Gastrointestinal manifestation, the complication may be nausea, vomiting, abdominal pain, and the gastrointestinal bleeding, or the colitis. These all are the gastro intestinal manifestation. And in the skin or cutaneous manifestation, skin mane apan mane janichindi specifically that itching, flushing, urticarial rashes must be there. Angioedema means swelling of the both the blood vessels. And in respiratory manifestation, mainly that running nose, cough, airway obstruction, wheezing, laryngeal edema, asthma, and the rhinitis. In the systemic manifestation, mainly failure to treat anaphylactic or the hypotension, dysarrhythmia. What is the cause of allergic reaction? The cause of allergic reaction mainly some risk factor, like some of the if our father is not tolerant to the Corella, then the offspring will be may or may not be like the Corella. Like that, the risk factor for the allergic reaction is hereditary, atrophy, antigen exposure, and the GI permeability, gastrointestinal permeability, amount of antigen presented, and the environmental factors is also play a very risk factor. And that cause of the allergic reaction mainly common food allergens, food with the high protein content, usually of the plant or for marine origin also. What is food intolerance? Food allergic and food intolerance both are different. Food intolerance is a digestive system response rather than the immune system response. Okay, all of you clear about this? In the food allergic, now food allergic is totally different from that of the food intolerance. In the food intolerance, mainly digestive system response rather than that the immune system response. And these food intolerance it mainly occurs when a food component irritate a person digestive system. And when a person is unable to properly digest or break down the food, it is non-allergic hypersensitivity, which can occur for variety of reasons. Okay, food intolerance. And many factors may also contribute to the food intolerance. Okay, out of that, now lactose intolerance, the person lacks the chemical called the enzyme necessary to properly digest the certain protein found in the food. And those who are having the lactose intolerance, and also the common are intolerance to the some chemical ingredients added to the food to provide the color, changes the taste, and the protect against the growth of bacteria also. And mainly the ingredients includes various dyes in the MSG. What is MSG? MSG or monosodium glutamate, a flavor enhancer. Okay, monosodium glutamate is the mainly we are using for this MSG for the flavor enhancer. What is the treatment in the management of the adverse food reaction? Mainly, the management of the food allergic is divided into two types. One is the diagnostics history, and the another one is your medical management. What is diagnostic history? In the diagnostic history, mainly the PM, physical examination, food systems, dairy, biochemicals, immunological test, and food elimination. Diagnosis ରେ ଏସବୁ ଆସିବ, but in medical management ରେ principal in the acute cases only, that is the medical management. And nutritional management means reintroducing of the foods by food challenges, avoidance of the food allergic provides the alternate food. That is your nutritional management. An allergic specific list of food to avoid. Mainly, those are having the food to avoid the milk and dairy product. Because in the milk and the dairy product, milk and milk solids like the milk and dairy contains the food. Milk based sweets ଏସବୁ ଯେଉଁମାନଙ୍କର milk allergic ଥିବ all the dairy product in the milk product should be avoided. And some of the patients also complain about the egg allergy. In that case, you have to avoid to take the egg for that particular patients. What is probiotic? Probiotic one? What do you mean by probiotic? Probiotic କହିଲେ ଆମେ କ'ଣ ବୁଝିବା?
Probiotic are live bacteria that are helpful for our health conditions. One of the example of probiotic is curd.
What is that probiotic? Why it is required?
ଆମ ଗଟ୍ ହେଲ୍ଥକୁ ଇମ୍ପ୍ରୁଭ୍ କରିବା ପାଇଁ ହେଲ୍ପ କରେ।
କ'ଣ କହିଲେ?
ଇମ୍ପ୍ରୁଭିଂ ଗଟ୍ ହେଲ୍ଥ।
Its action is means role is to mainly to improve the gut healthy. Probiotics is very much important in the control of the food allergic. Okay, and probiotic mainly probiotic is the what? It's act against the mainly it is useful for the control of the food allergic, this probiotic, and the microorganism and their culture product now which contribute to the intestinal and microbial balance fine, thus mainly benefiting the host by the protecting against the different type of disease and improving its nutrition. That is the probiotic. Mainly this probiotic is helpful for the improve of the digestion by helping the intestinal tract control the absorption of the food allergic or by changing the immune system response to the food. Okay, probiotic like the lactobacillus assist in the digestion of the lactose. Okay, lactobacillus is also one type of probiotic. It's also mainly required for that probiotic like lactobacillus mainly it assists in the digestion of the lactose. Prevention of the adverse food reaction. How we will prevent the adverse food reaction? The adverse mainly the adverse food reaction. There are 3 stages of allergic sensitization or the elicitation of the disease. Mainly the preventive strategy to can be mainly these things will be divided into 3 parts. One is the primary prevention, second one is the secondary prevention, and the third one is your tertiary prevention. What is primary prevention? Primary in the primary prevention mainly it will focus on the blocking the sensitization and the developing of the IgA mediated response. Okay, that primary prevention means it mainly focus on the blocking sterilization and also it develops of the IgA mediated response also. This strategy would be useful for those individuals who have no atopic disposition but no sterilization, sensitization. In the secondary prevention, mainly it inhibits the expression of the disease despite sensitization. That is your secondary prevention. In the tertiary prevention, mainly control of the factors that cause the symptoms. Mainly you have to, in the tertiary prevention, you have to control mainly target the control of the factors and that causes any kind of symptoms. What do you mean by ectopic? What is ectopic? What do you mean by ectopic? Ectopic means mainly it is caused by the hereditary predisposition towards the developing the certain hypersensitivity reaction such as the hay fever, asthma, chronic urticaria upon the exposure to the specific antigen also. It's very important chapter. It is the nutrient and drug interaction. What do you mean by nutrient and drug interaction? Simple things. What do you mean by nutrient and drug interaction? Very easy. Nutrient and drug interaction means what? What do you mean by nutrient and drug interaction? Yes, Arpita. Don't know. अरे drugs माने कौन? What do you
medicine,
mean? Yes, very
medicine.
good. Medicine. Nutrient drug interaction माने कौन? Simple things, sir. Simple things. Very good. एमिति किछिटा drugs अछि जो while we are taking the drugs na at that time there some type of foods is totally prohibited because it will impact upon the drugs and it will reduce the efficacy of the drugs. It will be not absorbed properly. Due to that only na after any kind of surgery or any kind of severe complication the in if I will if I will say about the cardiological complication, in some cases of cardiological issue, now you have to go through the file what medication will be doctor wrote. Accordingly, you will be give the diet chart. Because in that case, now if some patient will be take some kinds of in the CABG case that some medication is going, if at that time we will supply the high amounts of that means vitamin A rich food, then it will interact with that drugs. It will not absorb properly the drugs. It will hamper the absorption of that drugs inside our body. Understood? And that is called is your drugs and diet interaction. Nutrient and drug interaction means nutrient and drug interaction, the basic concept effect of the nutrition on the drugs. Okay, and that drugs effect on the nutritional status, drugs and drugs interaction, and clinical significance and the risk factors for the drug nutrient interaction. What do you mean by drug and diet interaction? Drug diet interaction means simply आमे देखिबा जेतेबेले simply जेतेबेले गोटे पेशेंट रो सीएबीजी हेतिबो कोनोसी कारणवशतः सीएबीजी कोरोनरी आर्टरी रो जे ओपन सर्जरी हेछि तो ता या अदर काइंड ऑफ कार्डियक इशू केस रे हमर स्पेसिफिक टाइप रो किछि मेडिकेशन चली थाए आ सेही मेडिकेशन सहित जदि हमें से समय किछि अदर डाइट जदि विटामिन के रिच फूड दबा ताले सेही जो टैबलेट्स दिया है ब्लड को थिन करिया पाई तो एते जेतबे विटामिन के रिच डाइट दे दबा ताले से आउ ब्लड को से थिन करिवनी ताको ठीक कर दबा तो सेही भले जिंस बहुत सारा मेडिसिन अछि जोटा कि ड्रग आ डाइट इंटरेक्शन किछिटा ड्रग्स चलला बेले केतरा डाइट को हम टोटल से समय बंद करिबा दरकार तो दैट इज कॉल्ड एज योर ड्रग्स एंड डाइट इंटरेक्शन बुझियला all of you understood?
Yes, ma'am.
Yes, ma'am.
Okay. So mainly na the drug and nutrient interaction mainly it includes the specific changes in the process by which na drug is absorbed and the drug is mainly distributed and metabolized and eliminated by the body, caused by the nutrient or change to the kinetics of the nutrient caused by a drug. That is called as the drug and diet interaction. Okay. And that nutrient drug interaction is a very broader term that also mainly includes the effect of the medication on the nutritional status. Mainly that nutritional status refers to the condition of the health of the individuals are influenced by the utilization of the nutrient. Nutrient status may be impacted by the side effect of the any kind of medication. And due to the drugs which could include an effect on the appetite also or the ability to the eat. That is the drug and diet interaction. What is the benefits of minimizing the drug and nutrient interaction? Mainly the medication achieves the intended effect and the continuity of the prescribed drug by the patient and fewer diet or calorie supplement is required and optimal nutritional status is maintained and disease complication is also minimized and the cost of the healthcare services is reduced. That is the drugs and diet interaction. Mainly drug interaction can occur that modifying the activity of the drugs. Means some of the drugs that decrease or increase the drugs effect are referred to the drugs interaction or the impair the nutritional benefits of the certain foods are called as the drug nutrient interaction. And the drugs and the diet relationship can be categorized into mainly two aspects. One is the effect of nutrition on the drugs and the effect of drugs on the nutrient. That means what first is your effect of nutrition on the drugs. The influence of the nutritional factor on drugs and its absorption, its action, its effectiveness. And effect of drugs on nutrient means it influences of the drugs on nutritional intake, nutritional metabolism, its excretion and the requirement also. It's the drug and nutrient relationship. Mainly now the food or the nutrient that effect on the drug absorption. That means the pharmacological effect of the medicine that mainly depends upon the rates and extent to which it is absorbed from the GI tract. And food can decreases a drug's rate of absorption or increase the extent of absorption of the numerous drugs. Example होची जेमती कि जो tetracycline हो कि penicillin हो, the possible reason for which they are mainly that penicillin and tetracycline delay the gastric emptying. And also it also alter the pH value of the GI tract, and also competition for binding sites with the nutrient, and that absorption or the addition of food or food component, and dietary fat impeding the absorption of hydrophilic drugs. These are the all about your drugs and diet interaction. Like gastric emptying may be delayed by the consumption of the high fiber meal. आपण देखिथिबे जेतेबेले हाई फाइबर रिच नौ चंती से समय आपण बहुत समय पर्यंत आपनकर सेटिटी वैल्यूटा रही थाउती सेट पे तो आपनकर जो मानकर कार्डियक कॉम्प्लिकेशन थाउची किबा जो मानकर हमर हाई ब्लड रे ग्लूकोज लेवल रही तो सेतेबेले हम कोन करथांती यदि फाइबर रिच फूड दे देबा ताले कोन बहुत समय पर्यंत गैस्ट्रिक एम्प्टीटा बहुत लेट हो या फल रे कि आपन ब्लड रे ग्लूकोज लेवल मेंटेन हो एवं पेशेंट को मध्य ज्यादा ज्यादा भूख लागबनी कि ब्लड रे ग्लूकोज लेवल बढ़िबो नाही तो chilation reaction occurs between certain medication and the divalent or the trivalent inhibition. That means just as the magnesium, calcium, iron, etc. And the absorption of the drugs may be reduced by the combination of one of these metal ions. बुझिएला? And specifically, the absorption is the another mechanism by which the drug absorption is slowed or reduced. सेट पे बहुत सारा ड्रग्स चलला बेले बहुत सारा डाइट रो को मना करा जाय थाए. An example of this mechanism is the cardiovascular drugs digoxin, which should not be taken with the high phytate food, such as high phytate food रही oatmeal रही and wheat bran रे मध्य रही. Specifically for the management of cardiovascular disorder, that consultant are using the drugs. Its name is the digoxin, and due to the side effect of the digoxin, it should not be taken with the high phytate foods. In those food which contain the high phytate level of foods, we should be eliminate the high phytate foods with the digoxin types of drugs. And the high phytate is present in the that oatmeal or the wheat bran also. In the calcium in the milk and dairy product, the dairy product contains the rich source of calcium, and it also impact upon some kinds of antibiotics, including the tetracycline also. Therefore, these foods should not be eaten at the same time when these drugs you are using, like tetracycline. At that time, you have to eliminate in some types of, when you are taking the some types of antibiotics like tetracycline, at that time you have to prohibit that intake of yogurt or the cheese or the milk or dairy product foods. Okay, it will severely impact upon our body. Therefore, these foods should not be eaten at the same time the drugs is taken, so that the full doses of the drugs is available for the adequate treatment of the infection also. Okay. And tyramine is another type of drugs. It is mainly used for the raised blood pressure, and the tyramine is used for the vasoconstrictor. Okay, it mainly raises the blood pressure, and the tyramine is main action is that it acts as the vasoconstrictor. And this tyramine, after ingestion of the high tyramine food such as the যদি আমি চিজ হোক কিংবা মিট হোক or any kind of individualized being treated with the monoamine oxidase inhibitors, that is the MAOAP. ध्यान दे दो तुम्हारे को MAOI is your monoamine oxidase inhibitors, and this MAOI is the drugs which is act as the antidepressant drugs, and that also cause the hypertensive crisis, such as the it also increase your heart rate level, and also it causes the stroke or headache, and finally it causes the death. Okay, so in that case you have to eliminate that the food which contains the high tyramine, and tyramine is high, means more amount of tyramine you can find from the cheese or the cured meat also. Similarly, we are regular basis we are taking the caffeine also, coffee. In coffee also, that we are using that coffee like a beverage. It also increase the adverse effect of the stimulant drugs like the amphetamines or the or the it also causes the nervousness and tremor and insomnia. निद्रा मध्य तार हबो नाही. And the main example of the drug and food interaction is vitamin K. Vitamin K, the richest sources of vitamin K were found from the all the coffee and the beef liver and all the grainy leafy vegetables, tomatoes, and the green tea also contains the richest sources of vitamin K. But some non-prescription vitamin minerals product can antagonize the anticoagulant effect of the warfarin. तो मुझे जोटा कहूली जो मानकर सीएबीजी पोस्ट सीएबीजी केस रे से मानकर स्पेसिफिकली वार्फारिन बोली गोटे मेडिकेशन चली थाए एंड दैट जितेबाला वार्फारिन नेउ थांती से समय में स्पेसिफिकली ए जिनसटा को विटामिन ए रिच फूड गुडा खाद्य रे प्राय एलिमिनेट करबा निहाती दरकार जिते विटामिन के सहित से वार्फारिन नब ताले तार बहुत सारा साइड इफेक्ट रही, that is your drugs and diet interaction, and resulting in the decrease the anticoagulant activity and the lower the prothrombin time. Okay, if we will combinedly take the warfarin along with the vitamin K rich food, then it causes the what anticoagulant activity and also lower the prothrombin time, and the laboratory blood test also. If you will test the PT, means prothrombin time, it will lower. If you will be combinedly taking the vitamin K along with that of the warfarin drugs. Okay. And similarly, if you will consume the calcium in vitamins, minerals product and the liquid enteral nutritional supplements interact with some fluoroquinolone antibiotics. Okay. So while you are taking the fluoroquinolone antibiotics and with the phytoin, and in the combination with the calcium and the vitamins, minerals product like the rich sources of calcium, if you will consume with these antibiotics, it will reduce their bioavailability, and also it resulting in the decrease the antibiotic activity also, and loss of seizures control respectively. And specifically that aluminum, magnesium and calcium found in the supplement or the antacids. जो भी antacid आपण लिखिथिबे सेतरे नियंत्रित रूपे ए सब जिंस गुडा को थाए. तो antacid होची गोटे compound bound chelate with the ciprofloxacin and tetracycline to form an insoluble complex, resulting in the significantly decrease the absorption of these antibiotics and decrease the antibiotic effect also. That's why you have to, while you are taking this type of antibiotics, you have to eliminate this type of diets. This is the drugs and diet interaction. And specifically, the pyridoxine. Pyridoxine is otherwise called as the vitamin B6. And these pyridoxine you will be got from the avocados, beans, peas, sweet potato, popcorn, pork, tuna, and some non-prescription vitamin minerals product increase the metabolism of the levodopa, producing the decreased blood levels of the dopamine and the anti-Parkinsonism effect. तो से समय रे मध्य आमे ए सब जिंस गुडा को प्रोहिबिट करिबा. This is all about the drugs and diet, drugs and nutrient interaction, and food's effect on the drugs transport. Many drugs are transported in the blood found to plasma protein also, but severe malnutrition or the disease affecting the synthesis of the plasma protein, it reduces the body's ability to transport the drugs and then impair their effectiveness. Like the albumin is the most important drug binding protein in the blood. So low serum albumin level provides the fewer binding sites for some highly proteins bound drugs such as the warfarin and the anticonvulsant phenytoin, because it may leads to the risk of the excessive anticoagulation, ଅଧିକ coagulate ବନିବ, and that also cause the bleeding or the toxicity. Bleeding ବି ହେଇପାରେ, ସେଥିପାଇଁ ସେଇ ସମୟରେ ସେଇ ଜିନିଷକୁ ମଧ୍ୟ ମନା କରାଯାଏ। Similarly, the sodium intake, regular basis we are taking the sodium this diet, and the sodium intake also inversely affects the serum level of the mood stabilizer, lithium carbonate, and that's when these drugs has a very narrow range of therapeutic effectiveness. And dietary sodium intake must be kept to a constant level in the patient receiving this treatment. जो माने से lithium carbonate नौचंत तो से समय हम टिके sodium जो हम खाद्य रे नौचंत सेटा टिके मध्य हम चेक करबा दरकार। And similarly, certain nutrient can also have the direct influence on the drug metabolism, like the vitamin K. Vitamin K is, all of you know that it acts as the anticoagulant effect on the warfarin, and that the doses is to be sufficient to counteract the effect of the habitual vitamin K intake. Okay. And food's effect on the drug utilization. Food effects on the drug's utilization means what? The like the liver and the green leafy vegetables can decrease the effect of anticoagulant. बहुत जानवर भी ऐसे ही कोई चीज जो liver and the vitamin K rich food and that greeny leafy vegetables can decrease the effect of the anticoagulants, and these foods mainly contain the vitamin K, and which helps to promote the blood clotting. Okay, on the other hand, the like aspirin and the aspirin containing compounds can enhance the effect of the blood thinning drugs and promote the excessive bleeding also. Okay, and natural licorice contains a substance which can increase the blood pressure when eaten in large amount. Okay, the licorice it contains a substance, mainly it will increase the blood pressure when it is eaten in the large amount. Long-term use of this licorice and the licorice flavored candy or any kind of drugs, it counteracts the effect of the medication used for the treating the mainly high blood pressure. Okay. And mainly the effect of the food on the drug excretion. That means the food effect on the drug excretion also. Food and nutrient can alter the absorption of the drugs from the renal tubules. Okay, that's when mainly urinary acidity affect the drug reabsorption from the renal tubules. That's why a change in the urinary pH by food may changes the amount of drug existing in the non-ionic state, and it also increase or decrease the amount of drug available for the tubular reabsorption. Effect of nutrient supplement on the drugs. What is the effect of nutrient supplement on the drug? Mainly that a nutrient or the nutrient supplement can alter the pharmacological action of a drug by enhancing the drug effect or by opposing it also. And this can result in the drug nutrient interaction. Okay, warfarin is in the oral anticoagulant जोटा कि reduce the production of the vitamin K dependent clotting factors by inhibiting the conversion of vitamin K to a usable forms. And specifically in excessive amount of vitamins, minerals like the drug instead of nutrient, and nutrient in excessive amounts may interact with the other nutrient or may even be toxic also. Drugs also effect on the nutritional status. That means if you are taking the antacid, now antacid can lead to the phosphate depletion. बुझिपारे ना जो मैंने लॉन्ग टर्म धरिक एंटासिड नौचंती इट कॉजेस द व्हाट फॉस्फेट डिप्लेशन एंड जो फॉस्फेट बॉडी रो डिप्लेशन हैला दिस लीड्स टू द विटामिन डी डेफिसिटी इन सीवियर केसेस and also in some patients have the developed osteomalacia or softening of the bones due to the loss of calcium because of the vitamin D deficiency जो माने long term antacid नियंती से से माने करा bone रो density कमी जाता है and that also that से माने बहुत सारा vitamin D रो deficiency थांती and they are very prone towards the osteomalacia and also calcium deficiency is very common for them. एंड जो माने अधिक डाययूरेटिक ड्रग्स नियंती जेमति कि जो माने कर ब्लड प्रेशर ज्यादा रहतो कम नतो किबा जो माने कर गोड़ो हाथ पेडाल ओडे मातिबो गोड़ा तो फुली की रहतो वाटर रिटेंशन होतो से वाटर कंटेंट को कमिया पे हम डाययूरेटिक मींस दैट ड्रग्स यूज्ड फॉर द एक्सेस यूरिनेशन जेते हम एक्सेस हेजबो तो बॉडी रो वाटर कंटेंट ता कमी जिवो कि जो फुली फली की थिबो शरीर से मध्ये कमी जिवो. And the excessive use of the diuretics mainly may result in the loss of the electrolyte, mainly the potassium, and this may put people with the heart problems at a high risk of serious heart rhythm problems. And people taking these diuretic regularly should eat foods which are very good source of potassium because semanakara generally जो माने diuretic drugs नेउ थांती furosemide होची कोटे diuretic drugs ता ब्रांड होची लासिक्स मध्ये मार्केट रे आसुची तो ए सब नेला फଳରେ मध्ये आपनकर पोटासियम इलेक्ट्रोलाइट रो डेफिसिट थाय स्पेसिफिकली पोटासियम लेवल ता कमी जाय थाय सेटु while we are consuming that diuretic drugs like the furosemide or the laxix na at that time we have to take more amount of that vitamin K rich food like the orange ho किबा आपनकर टेंडर कोकोनट वाटर हो नले ग्रीन ग्राम दाल हो जो थे कि रिच सोर्सेस ऑफ पोटेशियम थिबो से बेला डाइट टोमेटो हो किबा आपनकर बनाना हो रेजिन्स प्रून्स पोटैटो इज आल्सो potato sweet potato winter squash all these are the rich sources of potassium is there. Okay. And those women those who are depends upon for the oral contraceptive pills now over long periods of times na then for them may develop folic acid and the vitamin C deficiency is very common for them. That's why if they will be depends upon the long term for the contraceptive pills na the base sources of folic acid are the all the greeny leafy vegetables, specifically the spinach and the greeny leafy vegetables, broccoli and lima beans, and in the they have to take the rich sources of vitamin C and vitamin K. And the excellent source of vitamin C is your oranges, grapefruits, and lemons, strawberries, tomato, potato, cabbage, and the green pepper. That means if you will be long term, if you will be consuming that oral contraceptive pills, na you have to increase the intake of vitamin C and the vitamin folic acid also because if you will long term consume these oral contraceptive pills it may be decreases the level of your vitamin C and the what folic acid. And in some drugs is used for the seizure. Okay. And that is your anticonvulsant drugs, and that anticonvulsant drugs can lead to vitamin D deficiency, folic acid deficiency. If one person or one will be consumed for the long time of anticonvulsant drugs na for them there is a chance of vitamin D and the folic acid deficit is very common. To overcome that one you have to take the richest sources of vitamin D and folic acid every day. And like that the anti-hypertension drugs like the hydralazine, the name of one anti-hypertension drugs means the medication which is required for the decrease of your blood pressure, that is the anti-hypertension drugs. Its name is hydralazine, and that hydralazine can deplete the body supply of the vitamin B6. Okay, and this vitamin is widely distributed in the food, and the sources of these vitamin B6 rich foods are the chicken and that whole grains, bread, cereals, egg yolk, and fish, liver, that banana, potato, and consumption of these foods should be encouraged. Okay, if someone will be taking this anti-hypertensive drugs like the hydralazine, now you have to take more amount of vitamin B6 rich food. Okay, and some drugs like the colchicine. Colchicine is the drugs. It is mainly used for the gout. जो मानकर आंतुगंठी दरज रोचे, for them only we are using the colchicine drugs, and oral anti-diabetic agent also, antibiotic like the neomycin. ये तीनटा ग्रुप रा मेडिकेशन जी नोतिबे to the either diabetic को कंट्रोल करिया पाई हो, otherwise neomycin types रा antibiotics हो, किंवा gout को कंट्रोल करिया पाई the colchicine जो drugs होची, they are very prone towards the deficiency of vitamin B12, and B12 is highly required for each and everyone. And person who do not eat any animal product like the vegans may have the poorer vitamin B12. ଆପଣ ମାନେ ଜାଣିଥିବେ ଯେଉଁମାନେ ଭିଟାମିନ୍ B12 ନିଅନ୍ତିନି ସେମାନଙ୍କର କ'ଣ ଆମିଷ ଖାଦ୍ୟ ବି ଖାଆନ୍ତି ନା ଗୋଡ଼ ହାତ ଝିମ୍ ଝିମ୍ ହୁଏ, ଥରେ ପୋଡ଼େ, ଭିଟାମିନ୍ B12 ଡେଫିସିଏନ୍ସି। तो एमानंको आमे निहाती रूपे विटामिन B12 रिच सोर्सेस आमे खाद्य शामिल करबा निहाती दरकार। जो ड्रग्स नेले जो विटामिन रे डेफिसिट रहउची ताकू आमे न्यूट्रलाइज करिया पई से भले डाइट आमे नबा निहाती दरकार। अदरवाइज इट विल कॉजेस ना so many complication. To control over that na you have to take that type of diet. Okay. राकेश राकेश
Yes, ma'am.
किछि बुझिला?
Yes, ma'am. बुझियला.
राजलक्ष्मी मैम किछि बुझि पारले?
Yes, ma'am.
এই দুইটা को थेरापेटिक न्यूट्रिशन पूरा पढ़ंतु आपण माने जोति किछि भी डाउट रहबो एट एनी टाइम आपण मते पचारि परिबे। जहाँ भी आपनकर डाउट रहले जो सिस्टम विषय भी फिजियोलॉजी हो या रिलेटेड टू आपनकर थेरापेटिक क्लिनिकल एंड थेरापेटिक न्यूट्रिशन मते एनी टाइम यू कैन आस्क मी। ओके,
Okay, ma'am.
थैंक यू,
Okay, ma'am.
थैंक यू,
Thank
Thank
you.
you, ma'am.
वेलकम।